never too late to quit smoking. Your body actually starts repairing itself within 20 minutes of quitting.
Within 20 minutes, your body starts to repair itself. Within 8 hours, there is oxygen in your blood, mucus begins to clear your lungs, breathing will become easier with time. Within 3 months, your blood circulation improves and your body is better able to fight infections. Within 48 hours, things taste and even smell better. Within 9 months, you have less sinus congestion, wheezing, and shortness of breath. After 1 year as a non-smoker, your risk of dying of a heart attack is cut in half. Within 5 years, you have a decreased risk of stroke. Within 10 years, your risk of getting lung cancer is cut in half.
It is never too late to quit smoking, and don't ever let anyone tell you differently. There are many questions that you should ask yourself before you begin quitting, and some questions you should ask your healthcare provider.
Before you start, ask yourself these questions. Why do you want to quit? When you tried to quit in the past, what helped and what didn't? What will be the most difficult situations for you after you quit? How will you handle them? Who can help you through the tough times? Your family, friends, a healthcare provider? What pleasures do you get from smoking? What ways can you still get pleasure if you quit? Questions you can ask your healthcare provider. How can you help me to be successful at quitting? What medications do you think would be best for me and how should I take them? What should I do if I need more help? What is smoking withdrawal like? How can I get information on withdrawal?
It's always a good idea to write down your questions and comments for the doctor. When you go into an appointment, they generally provide you with a lot of information and you can lose your train of thought at any time. Most people don't even know how to start or where to start. Let's review that now. We've been telling you a lot of what smoking does and smoking facts, but why is it that you should actually quit smoking? Quitting smoking is one of the best and most important decisions you will ever make. Every smoker should consider quitting smoking, but especially those with special conditions, such as pregnant women or new mothers, hospitalized patients, heart attack patients, patients with lung, head, and neck cancer, and parents of children and adolescents. Overall, you will live a longer and better life with better health. Quitting smoking will lower your chance of having a heart attack, stroke, or cancer. If you are pregnant, quitting smoking will improve your chances of having a healthy baby. The people around you and those who live with you will be happier and healthier, especially if you have children. You will also have extra money to spend on things other than cigarettes. Let's now look at the 5 key points for quitting. As seen in the Long Island Health Network's Consumer Guide from the U.S. Department of Health and Human Services, there are 5 keys for quitting. Studies have shown that these 5 steps will help you quit, and quit for good. You have the best chances of quitting if you use them together. The 5 keys for quitting are: Step 1. Get ready. Get support. Learn new skills and behaviors. Get medication and use it correctly, and be prepared for relapse or difficult situations. Step 1 is to set a date. Pick a date and mark down on your calendar the specific day you choose to quit smoking. This will serve as a marker for you to go back and see your progress over time.
How about a month from today?
Okay.
You also want to change your environment and get rid of all cigarettes, ashtrays in your home, car, and place of work. You want none around to have the temptation to smoke. Look at the last attempts you made to quit. If your family or friends smoke in your home, ask them not to. It's also great to sometimes have a smoking buddy to work out your problems and the process together. Once you quit, make it for good. Never take a puff again. Get support and encouragement. The more people that want to help you and see you successful, the more successful you'll be. Based on research, you have a better chance of being successful if you have help. You can get support from your family and friends in many ways. Tell those around you that you are going to quit smoking and ask for their support. Counseling can be beneficial as well. Programs at local hospitals and health and wellness centers can help you with counseling groups. Tell your healthcare provider. They will have great advice, encouragement, and be able to help you on your journey. You need to learn new skills and new behaviors. Try using distraction therapy. Talk to someone, go for a walk, and start a task to avoid the urge to smoke. Make sure you drink a lot of fluids, including a lot of water. Do something to reduce and help relieve your stress. Reading, taking a bath, going for a walk, or even doing yoga. A great thing to do is to change your routine when you try to quit. A different driving route to work, a different drink in the morning, or even eating breakfast differently. Get medication and use it correctly. There are several medications designed to help you fight the urge to smoke, and they can help you stop smoking. Be sure to ask your healthcare provider for advice before taking any medication. The U.S. Food and Drug Administration has approved 5 medications to help you quit smoking. These medications come over the counter or by prescription. They are offered in pills, gum, inhalers, sprays, and patches. The medications that we are about to list most likely improve your chances of quitting for good. The FDA has approved these medications to help quit smoking. All those trying to quit can benefit from these medications. However, those who are pregnant, smoke fewer than 10 cigarettes a day, have a medical condition, are under the age of 18, are nursing, or looking to become pregnant should speak with their healthcare provider first. Be prepared for relapse or difficult situations. Most relapses occur within the first 3 months after quitting. Don't be discouraged if you start smoking again. Remember that most people try quitting several times before they can finally quit. Here are some difficult situations to watch out for. Avoid drinking alcohol. Alcohol can lower your chances for success. Avoid being around others who smoke and who will make you want to smoke. Eat a healthy diet and be active. Many times smokers gain weight when they try to quit and replace smoking with eating. Improve your mood with other ways than smoking. Avoid bad moods and depression. Your doctor or healthcare provider are always great people to talk to when trying to quit smoking. They are a great source of support and will always be there for you.
So Katie, nurse to nurse, so when you have a patient or somebody in the public community comes up to you and says, I want to quit smoking, what do you usually tell your patients or these people?
Well, I encourage them. That's excellent that they've decided to quit. And most important would be to find their local resources. They can certainly speak to their physician, stop at a local hospital. They have tons of brochures. They have internet access. There's many websites to help. There's New York State Quits, which is an excellent resource. They have many free opportunities for the nicotine gum patches.
That's good. Oh, that's I'll inform some of my patients about it.
Don't forget, your healthcare providers are always there for you. Now let's learn what's in a cigarette. There are approximately 600 ingredients in cigarettes. When the cigarette burns, it creates about 4,000 chemicals. This is the inside of a cigarette, just one cigarette alone. At least 50 of the chemicals in cigarettes are known to cause cancer. Why would you want to inhale this and put this into your body? Many of the chemicals found in cigarettes are found in other items such as these: acetone, acetic acid, ammonia, arsenic, and more. If a chemical is as powerful to take off nail polish, imagine what it can do to the inside of your body. It is not uncommon to go around your house and find household products, cleaners, bathroom cleaners that all have the ingredients that are in cigarettes in these chemicals. All the more reason to want to quit.
We're now going to explore the different ways to quit smoking.
If you are a smoker and motivated to quit, there's so many different options out there for you. The most important is to design a personal game plan for your own needs. You can stop cold turkey. There's plenty of medications out there to help, like Chantix or other pills. There's nicotine patches, gum, inhalers. If you don't want to try a medication, they have acupuncture, hypnosis. There's just so many options out there, and most important is knowing the available resources that can help you quit smoking.
There are many different ways to quit smoking. Let's explore some of the things that can help you along. Gum and lozenges. Some people need a distracting method. By chewing gum instead of smoking a cigarette, you can replace the habit of smoking. Nicotine gum is a medication that you can chew slowly that will make your craving for nicotine less intense. It gives you a little nicotine without tars and poisons that you get from cigarettes. You can buy it anywhere without a prescription. Medications are another method. There are pills that you can take by mouth. These pills do not have any nicotine but can help reduce your craving for nicotine. In most cases, you will need a prescription. Patches. You put the patch on your arm. Nicotine from the patch slowly gets into the body. This is a way to get a steady amount of nicotine to help lessen the craving for a cigarette. You can usually buy nicotine patches without a prescription. Electronic cigarettes are also available. To break the habit of smoking, you can use these, which don't have the same toxins and poisons entering your lungs. Inhalers and sprays. You just breathe the nicotine in through the mouthpiece. Taking shallow breaths and shallow puffs, this gives you a little nicotine to help reduce the craving for nicotine. You will need a prescription. Counseling. Counseling can be helpful for support. You can go with your questions to a healthcare provider. You could speak with other people who are trying to quit smoking to get support and ideas for yourself. It never hurts to have support, and it never hurts to talk. This is one of the best ways to be successful, is if you keep open communication with all those around you about your smoking addiction. Cold turkey. Quitting cold turkey can be one of the most difficult ways, but if you quit cold turkey and you never turn around, you could be successful on the first try. It is one of the most difficult ways, and there are plenty of ways to help you along, but if you try to choose to cold turkey, all you need to do is throw your cigarettes away and never smoke again. There are many ways that you can distract yourself to help with quitting smoking. Watching TV, reading a book, or even listening to music. It's also a great idea to get outside and exercise, make plans with a friend, or even go jogging to keep your mind off smoking.